NHA Medical Assistant exam. Question 1. Which of the following is the most appropriate action when a patient refuses a prescribed treatment? Document the refusal in the chart and notify the provider. Attempt to administer the treatment regardless. Call the patient's insurance company. Discharge the patient immediately. The MA must respect patient autonomy. Refusal must be documented and the provider notified. Forcing care is a violation of patient rights and may constitute battery. The provider may attempt to address concerns. Question 2. When collecting a wound culture, what is the first step before swabbing the site? Rinse with sterile water. Remove excess exudate with sterile gauze. Apply an antiseptic solution. Touch the swab to intact skin around the wound. Remove excess exudate to prevent contamination and ensure the culture reflects actual wound pathogens, not surface debris. Then swab fresh exudate from deep within the wound. Question 3. Which of the following injections requires the Z-track method? Insulin injection. Intradermal injection for allergy testing. Intramuscular injection of iron dextrin. Subcutaneous heparin injection. The Z-track method is used for medications that can irritate subcutaneous tissue or stain the skin, e.g., iron dextrin, certain antipsychotics. It prevents leakage into subcutaneous tissue by sealing medication in the muscle. Question 4. A patient becomes diaphoretic and lightheaded after venipuncture. What should the medical assistant do first? Call emergency services immediately. Lay the patient flat and elevate legs. Apply a cold compress to the puncture site. Remove the tourniquet and needle, then stand the patient up. The patient is showing signs of vasovagal syncope, fainting. Lay the patient flat, supine, and elevate legs to restore cerebral blood flow. Remove needle first if still in place, then position patient. Question 5. The most critical step in performing a capillary puncture is warming the puncture site. Using the first drop of blood for testing. Choosing the most visible vein. Ensuring proper depth to avoid bone injury. Correct depth prevents inadequate blood collection and risk of bone injury, which could cause osteomyelitis in infants. Capillary punctures should be 2.0 mm or less for infants and 2.4 mm for adults. Question 6. Which of the following best defines a septic technique in a clinical setting? Complete removal of all microorganisms including spores. The use of alcohol for hand cleaning only. Practices that prevent contamination with pathogens. Sterilization of instruments only. A septic technique is not total sterilization but a set of practices, hand hygiene, sterile gloves, sterile field, to prevent contamination and protect patients during procedures. Sterilization is the complete destruction of all microorganisms. Question 7. A patient on anticoagulant therapy presents with a nosebleed in the clinic. What is the first action the medical assistant should take? Apply firm pressure while leaning forward. Have the patient tilt the head back. Insert nasal packing. Place ice packs on the abdomen. Apply firm pressure to the nostrils while the patient leans forward to prevent aspiration of blood. Leaning back can cause blood to flow down the throat, leading to nausea, vomiting, or aspiration. Question 8. Which of the following urine tests requires a clean catch midstream specimen? 24-hour urine protein. Random urinalysis for glucose. Culture and sensitivity. Pregnancy test. A clean catch midstream urine sample is necessary for culture and sensitivity to minimize contamination by normal genital and urethral flora. Proper cleansing and midstream collection ensure accurate identification of pathogens. Question 9. The correct angle for inserting the needle during an intradermal injection is 10 to 15 degrees, 30 degrees, 45 degrees, 90 degrees. Intradermal injections, e.g., PPD, allergy testing, are given at a shallow 10 to 15 degree angle to deposit medication just beneath the epidermis, creating a small wheal. Deeper angles would place medication in subcutaneous tissue. Question 10. Which patient preparation is most important before an abdominal ultrasound? Emptying the bladder. Avoiding fluids for 24 hours. Fasting for 8 to 12 hours. Drinking coffee to stimulate digestion. Fasting for 8 to 12 hours minimizes bowel gas that can interfere with visualization of abdominal organs, gallbladder, liver, pancreas. A full bladder is required for pelvic ultrasound, not abdominal. Question 11. Which of the following is a primary duty of a medical assistant in infection control? Developing antibiotic treatment plans. Performing surgical wound closure. Ensuring adherence to standard precautions. Prescribing antiviral medication. Medical assistants are responsible for maintaining infection control through hand hygiene, PPE use, and standard precautions. Prescribing, treatment planning, and surgical closure are outside the MA's scope of practice. Question 12. The best way to confirm correct patient identity before a procedure is to ask the patient their name and date of birth. Check the patient's room number. Look at the patient's appearance. Ask the patient's family member. Verbal confirmation of name and date of birth, two identifiers, prevents misidentification and ensures safe patient care. This is a national patient safety goal. Never rely on room number or appearance alone. Question 13. Which laboratory value would most concern a medical assistant and require immediate provider notification? Blood glucose of 120 mg per deciliter. Hemoglobin of 13g/dl. Potassium of 6.5 milliequivalent/L. Blood pressure of 118/72 mmHg. A potassium level of 6.5 milliequivalent/L is critically high, hyperkalemia, and may cause life-threatening cardiac arrhythmias requiring urgent treatment. Normal potassium is 3.5 to 5.0 milliequivalent/L. Question 14. Which of the following vaccines is administered subcutaneously? Influenza, inactivated. MMR, measles, mumps, rubella. Hepatitis B DAP booster. MMR is administered subcutaneously. Inactivated influenza, hepatitis B, and DAP are typically given intramuscularly. Route of administration affects immune response. Incorrect route may reduce vaccine efficacy. Question 15. Which of the following is an example of a CLIA waived test a medical assistant may perform? Blood culture. Glucose finger stick test. Pap smear cytology. Wound gram stain. CLIA waived tests are simple, low-risk procedures approved for point-of-care use. Glucose monitoring by finger stick is a common waived test. Blood cultures, pap smears, and gram stains require higher complexity certification. Question 16. A patient suddenly develops hives and shortness of breath after receiving an injection. What is the assistant's first response? Administer epinephrine if trained and authorized. Provide the patient with water. Wait to see if symptoms subside. Ask the patient about allergies later. This is an anaphylactic reaction requiring immediate intervention. Administer epinephrine if within scope and protocol, and call emergency services. Epinephrine is the first-line treatment for anaphylaxis. Question 17. When teaching a patient about wound care at home, the most important instruction is: change the dressing every hour. Keep the wound dry at all times. Wash hands before and after touching the wound. Avoid looking at the wound to reduce stress. Hand hygiene before and after wound care prevents infection and is the most essential home care instruction. Hand washing removes pathogens that could contaminate the wound and cause infection. Question 18. Which of the following is the correct order of draw for venipuncture? Red, lavender, blue, green. Blue, red, green, lavender. Lavender, green, blue, red. Green, red, blue, lavender. The correct order of draw: blue, coagulation, red, serum, green, heparin, lavender, EDTA. This prevents additive cross-contamination that could alter test results. Following order of draw is essential for accurate laboratory results. Question 19. A patient reports taking herbal supplements daily. What is the most important action for the medical assistant? Disregard unless prescribed by a doctor. Replace them with multivitamins. Advise the patient to stop immediately. Document the supplements in the patient's chart. Documentation is crucial since supplements can interact with medications or affect lab results. The provider must be informed to make appropriate clinical decisions. Herbal supplements can cause significant drug interactions, e.g., St. John's wort, ginkgo, warfarin. Question 20. Which of the following PPE is required when assisting with a patient on airborne precautions? Surgical mask. N95 respirator. Face shield only. Gown only. Airborne precautions require an N95 respirator, or higher, to filter small infectious particles, e.g., tuberculosis, measles, chickenpox, COVID-19. Surgical masks are for droplet precautions. Gowns, gloves, and eye protection may also be needed depending on the procedure.